Good day! I am Michelle Jane Sevilla, a student nurse from Davao Doctors College. Today, I will demonstrate the medical hand washing technique. So, the medical hand washing technique helps to prevent the growth and spread of pathogenic microorganisms from individual or environment to another. Medical hand washing is usually done at the start and end of the shift, before doing an invasive procedure, before being in contact with susceptible patients, before and after having a prolonged contact with patients, and when handling their article, dressing, equipment used in their care, and after having contact with a body surface, even when you're wearing a gloves. Medical hand washing also reduces the risk of cross-contaminating among clients, the transmission of microorganisms to clients and oneself. For this procedure, we would be needing a soap. It could be a bar soap or a liquid soap, and it is preferable to use an antimicrobial or antibacterial soap. A sink with top or lukewarm running water for rinsing, paper towels or single-use cloth or towel for cleaning and drying the hands, and a trash can right here to discard the paper towels. In doing this procedure, we must first prepare all the materials so that we won't waste our time. Next, we will be assessing our hands because it is important that we don't wear any jewelries as the microorganisms can lodge in the jewelries. Our nails should also be short, as short nails are less likely to harbor microorganisms, scratch the patient, and puncture gloves. Next, stand in front of the sink and keep your hands as well as your uniform away from the sink to prevent contamination. Uniforms can harbor microbes when it is damp, which leads to contamination of the uniform. Turn on the water, and today I will be using a hand-operated handle faucet as it is the only available type of faucet in our home. Regulate the flow of the water so that the temperature is warm. Warm water can remove the microorganisms more effectively and removes the less of the protective oil. Remember to not splash the water into your uniform as it could result in contamination as moisture breeds microorganisms. Now wet hands and wrist area thoroughly to rinse off the microorganisms and dirt into the sink. Wet it by holding them lower than the elbow under running water to allow the water to flow from wrist to the fingertips. Remember that it's important to rinse from the least to the most contaminated area. Okay, now inspect the condition of the cuticles of the hand and forearms or any abrasions of cuts or lesions because open cuts of the wounds can harbor high concentration of microorganisms. For this, I will be using a bar soap since this is the only available soap in the sink in our kitchen. Now apply a good amount of antimicrobial soap and lather hands thoroughly by rubbing palm to palm in a circular manner. Make sure to cover all areas of your hands with the soap and rub it vigorously. And now we're gonna put it back. So now we're gonna rub the back of each hand with fingers interlaced. Soap cleanses by emulsifying fat and oils, and it also lowers the surface tension. Now, rub palm to palm with fingers interlaced. So now rub the back of each hand with fingers interlocked. So interlacing and interlocking the fingers ensure that all surfaces are clean. Now pay attention to the thumb and rub it in a rotational manner. It is because rubbing and friction mechanically loosen dirt and microorganisms. Next, clasp the fingers and rub it into the palm of the opposite hand. And the other side. And now we're going to rub our wrists. And now we're done. And we're going to rinse off our hands under the running water. So our rinsing mechanically washes away the dirt and the microorganisms into the sink. And always remember that it is important that the water runs from the least to the most contaminated area. So we're going to start from the wrist to our fingertips. So avoid splashing the water into your uniform because the microorganisms travel faster and thrive best in moist area. And now we're done, and we're going to dry off our hands using paper towels. So starting from the fingertips to the wrist. And now we're going to discard this paper towel. And now we're going to use another paper towel for the other hand. From our fingertips again to our wrist. And throw this one also. And we're going to use another paper towel to turn off our faucet because the faucet is a contaminated area, and if we do touch that, then we'll have to redo the whole process again. Now, throw this paper towel into the trash can to prevent transfer of microorganisms. And now, our hands are clean, and the risk of having microorganisms is reduced. Remember, in healthcare settings, always follow the 5 moments of hygiene. Number 1, 2, 3, 4, and 5. Again, I am Michelle Jane Sevilla, Section 11B, Group 16, and a student nurse from Davao Doctors College. Thank you and goodbye.